So I'm Dr. Van Reken here at Reno Sparks MedSpa in Reno, Nevada, and I have a lovely volunteer, Brandy. And Brandy's got a little bit of a fat pad where she doesn't want it. And why do you have that little fat pad?
When I had my son at cesarean.
Okay, so how many years ago was that?
6.
And it kind of got poofy above that and not below it?
Yes.
All right. Did you have mesotherapy here in the past?
Yes.
Injections? And did it help?
Yes.
And what did it help specifically?
It shrunk a lot down in that area where I can actually fit my pants a little bit better and wear them. And I noticed it in my waist as well.
Okay, so it helps those two areas.
Yes.
So can we take a look and see what we're talking about?
Yes.
So if we lift up here, she's kind of poofy here, and then the C-section scar is right about there. Is that right? So we're going to try and shrink some of this, and it does work. But as we told Brandy in the past, it works better with more than one session. Now,
Yes.
if you want to get it all right away, you can do it surgically with a tummy tuck, and that's acceptable too. But you do get a pretty good scar, and for a tummy tuck scar, it's not unusual to have a scar from here to there. And I'm not kidding, it's about 3/4 of the way around. Some gals maybe only 180 degrees, but most people with tummy tuck scars, it goes onto the flanks on each side. So it's a pretty big scar. And if you see them years later, yeah, they look better in clothes, but sometimes those scars are split, they have blood vessels, and it's not always cosmetically really great. Now, mesotherapy is not as rapidly effective, no question about that, but it tends not to have scarring. The biggest side effect for mesotherapy in terms of something that is unsightly is you can have pucker marks when you stick these. Did you get any pucker marks from where we did stuff?
You can't even tell.
So you can't tell where you were injected. And how many times did we poke you? Maybe a 200 or something. So a lot of little close ones. That's our secret. The secret, I think, to effective mesotherapy is to take your time and do more injections and put them closer together. And the reason that's helpful is people pucker less. Okay, so without further ado, we'll go ahead and lie Brandy down, clean her up. We're going to do some dot to dot. We're going to mark her with a surgical ink pen. And then after this procedure, you will see that she'll hurt a little bit during it. That kind of stings, doesn't it?
Yes.
Yeah. Does it swell?
You'll be a little swollen, but
Yeah. How long does the swelling last?
maybe up to a week.
Okay. And how about the stingy pain kind of stuff? How long does that last?
24 hours, maybe 48.
Okay, so not too long.
Mm-mm.
So it's worth it to you.
Yes.
All right, well, let's do it. So what I'm doing right now is I'm marking her area of treatment, and we're going about 1.5 centimeters apart, which is a little bit over a half. It's about 1/2 inch, and so what we're going to do here is we'll be hitting all these areas, and you can see they're pretty close together. Okay, so here we go. We're going to give about 0.15. And each one of these syringes is a 1 cc syringe, so it's about 1.5 graduations. Sometimes at the border, I will give a little less to sort of morph it in more smoothly in terms of the cosmetic appearance. So right down here, she doesn't have as much fat. I'll give her a little bit less. You doing okay, dear?
Yep.
Kind of a sensitive area.
Mm-hmm.
And then back to normal amounts as soon as I get to where it's a little thicker. So on Brandy here, I have just finished this half, and this half is I'm still working on. So what's the pain like where I've injected at this point? Does it hurt some?
It just feels like a sting right now at the moment.
If 10's horrible and 1's a little, how much does it hurt right now?
It's about 4 or 5.
Okay, this is Dr. Van Reken signing off from Reno Sparks MedSpa. Stay good looking, and remember, you always have different options: surgery, mesotherapy, liposuction. Choose a doctor you trust, and they all have different advantages and disadvantages and prices. So stay healthy.